thanks for joining us for an intro to our practice.
Good afternoon.
So, what assessments do we do? How do we figure out what is going on so that we can help you? Everything that we do is geared towards getting to the root cause of the problem. So how exactly do we do that? The first assessment that we do at our first visit is called foundational nutrition. Foundational nutrition involves simple tests. They are so simple, they are often overlooked. And within minutes on your first appointment, we can determine a lot of really interesting things, gather vital information on your overall state of health, your healing capacity, your mineral balance, your hormonal balance, and your cardiovascular health. So we do that, the foundational nutrition. Then, as our second step, we do an assessment called nutrition response testing. This is the technique that we use to guide our care, visit to visit.
Yeah, visit. Yeah.
Visit to visit, and we also do it as an initial assessment. It is a biofeedback technique. It uses a muscle response to locate areas of stress in your body. Now, is it going to show you everything? No. But it is going to show you where the body feels that it is stressed and the big blockages to healing. For example, if your body's really lacking in energy in a certain area, it's going to show up.
Yeah.
And if you address it, what do you think is going to happen if you give your body like a lot of energy in an area where it's depleted? Well, you're probably going to really kickstart the healing process, right?
You'll feel better, yeah.
Yeah, and you're going to feel better. So this muscle test is so important, and it's also so accurate that, like I said, we do use it to guide your ongoing nutritional care. There are some videos on this technique. It is not a conventional technique by any stretch, so we do ask all of our new patients to watch those videos before they get started.
Yeah.
And they're with Dr. Sheehan, and he's got an amazing beard in the videos.
Amazing.
Yes, but he doesn't have that beard anymore.
No, sorry.
That was kind of old videos, but we think they're still good, so I just want to warn you that he doesn't have the beard anymore. All right, next.
Wait, can I add something?
Yes, you can.
I think it's important to understand that with the nutrition response testing, it's like you said, we use it to guide our day-to-day treatment of the patient.
Yes.
And the way that we look at things, the reason why we use a bunch of different things, and I explain this to patients on their reported findings, is that I look at it like if I was buying a house, I would want pictures of the outside, I'd want pictures of the inside, and I'd want an inspection. And so that's kind of what we do when we look at the body. We do the foundation nutrition, exam, then we do nutrition response testing, and then we do a comprehensive blood and urine analysis. And so they're like different pictures, pictures of the outside of the person, the inside of the person, and then an inspection of the person, kind of like you would do with the house. What's really cool about nutrition response testing is certain things do not show up well at all on blood testing, urine testing, or even in a history. And they show up very, very well with nutrition response testing. Those things being specifically immune system stress and digestive stress. Nutrition response testing is freaking incredible for that. Yeah. And oftentimes it goes, oh, this is what the person's big problem is. And that's the reason why we do it. And the other thing is that we can have feedback. The thing is, if you do a blood and urine analysis, you can do those, every week, every day if you want, but it becomes cost prohibitive. But the thing is, with the nutrition response testing, you can do that. I mean, like Laura will give me some supplements if I'm not feeling well, and she can check me in 20 minutes. And it'll actually, since the biofeedback, you can check it repetitively. And besides the office visit, it costs nothing. And so it's a very good way of keeping costs down.
Yes.
So anyway, that's why I love nutrition response testing. But
yes.
Anyway, go ahead.
Yes, we would not be without the nutrition response testing.
Absolutely not.
We would also, however, not be without the comprehensive blood and urine analysis.
I wouldn't do nutrition response testing without a blood analysis or a urine analysis anymore. No way.
So at the end of your first visit, you do leave with a script for that blood analysis. Mm-hmm. And these tests will show us how you're doing nutritionally in 13 key areas. That is different from looking at your blood from a medical perspective.
Which is diagnostic.
They're
looking for a diagnosis.
Yes, we're not necessarily looking for that. I mean, if it looks like you need a diagnosis, we will refer you out because we are not medical doctors, but we are nutritionists. So we are trained to look at your blood work, to kind of comb through it finely and it gives us really important clues as to where the nutritional imbalances may be in your body that are contributing to you feeling bad.
Yeah.
A lot of times you can not have anything, quote, abnormal on your blood work from a medical perspective, but there are clues on there that will show why you are feeling the way you are feeling and why you're actually looking for help. So that's what we do. We look at areas, for example, like blood sugar, digestion, immune health, liver, kidney, inflammation.
Right.
Those are some big areas. There's more. But it's like the big picture map of where we're going. And like Dr. Sheehan said, we do that once at the beginning, and then we'll do it again in a few months, but we don't have to do it every single visit.
No.
However, that kind of brings us into how we help. Once we know what's going on, having done the foundational analysis, the nutrition response testing, and the blood and urine analysis, we have a pretty good picture of what's going on in your body biochemically and what is causing your symptoms.
Right.
So what do we do about it? That's the second part, the nutritional therapeutics.
Right. Nutritional therapy. Can I make
Yes.
one more
Yeah, go ahead.
comment about the comprehensive blood and urine analysis? A lot of people will say, well, I have blood work, and so how does our blood work, what do we test for that is often not tested for in Western medicine right now?
Yeah, so they're looking for pathology.
Yeah.
So if they don't see anything that's way out of range or a real clear pathological pattern or something that they can easily give you a medication for, there's really nothing that they can do.
So what do they test and what do we test?
Well, they might do a chemistry,
Yeah.
blood count,
Yeah.
just to rule out, for example, if you have like leukemia or something.
Yeah.
Or really bad anemia.
Yeah, they basically are ruling out or ruling in medical conditions.
Right.
Whereas what we test for is we do not only the blood count and the chemistry, but we also do a complete iron panel. That's like really important.
Yeah, so important to know.
We
what
also
iron
do,
is.
we check for a lot of inflammatory markers that are not regularly tested for, but our regular old tests like basically inflammatory, like say high sensitivity C-reactive protein, we'll test for a homocysteine, we'll test for a fibrinogen. We don't usually do sed rate, but we can do that too. But we also do a more comprehensive blood sugar analysis. One of the things that is not done in Western medicine too much is a fasting insulin, which is actually by Mosby's textbook is the most important indicator of blood sugar stability. Is fasting insulin.
It is. Yeah,
that's what it
true.
says in in the medical textbook. We share textbooks, medical doctors and chiropractors. We also do check for folate and B12. We do a food allergy, or I should say a food sensitivity screening test. We do a bunch of different, sometimes we'll test for hormones. We test for a lot more as it pertains to the patient, whereas most of the time when you go to a Western medical doctor, what they'll do is they'll do just a complete blood count and a chemistry. So they're basically looking for overt pathology to rule in or rule out, whereas we're looking for more of an evaluation of how all the different body systems are working.
Yes.
And if you hear that coughing, that's my dog.
That's
Jackie.
Binky. You'll see him when you come into the office. He's 15. You got to forgive him.
And so if you see me pointing down, it's because he's trying to jump on our laps. I'm like, hey, chill out, buddy.
Yeah.
Anyway.
He gets a little antsy sometimes.
It's okay.
It's okay.
He's 15.
He's 15.
Right, sweetheart.
So we can go on to our therapeutic approach now.
Go ahead, yeah.
Yeah, so what is our therapeutic approach grounded on? It is grounded on the food that you put in your mouth. That is so important, and I feel like I harp on it all the time, but it's so important, the type of diet that you're eating. I've had cases fail because they just simply refused to cut out the foods that they were reacting to.
Yeah.
And I have cases succeed wonderfully when they finally said, this food is making me sick, I need to stop eating it.
And the thing is they, like, people will say, well, I wish there was like a comprehensive study, or I wish someone actually did research into what diet. There was actually a long time ago someone that he would feed his patients things, and he would take their blood tests up to 5 times a day afterwards to see how
This is when you could afford to have your own lab.
He had his own
Do
lab,
this.
and his name was Dr. Page, and that's the diet that we use. And we have found, I call it a normalizing diet. They call it the page diet, but I call it the page normalizing diet, and tends to normalize everything. So first it goes with, basically, and sorry, but they're having construction outside, which is never ending. Anyway, so there's first what we give it, basically we help a person with their diet, and then we assess for how they digest. And believe it or not, it shows up on blood tests. We confirm it with our muscle testing, with the nutrition response testing, but how you digest. And then we go into blood sugar.
Yes.
Okay, which also, unless you do a fasting insulin, is not properly done when you go into a Western medical doctor. And then we go into immune function, which we back up with our complete blood count, and then our nutrition response testing, and then everything else, right?
Yes, and then everything else.
And so how do we treat people?
Well, we use primarily diet.
Yeah.
Diet guidance,
Mm-hmm.
and we have a little bit of a training program to help you
Mm-hmm.
with your diet, because not everybody just can do it like that. Some people can, some people are already
Yeah.
on it, and it's not always the case that it's a dietary issue, but most of the time there's
Right.
a diet component. And then we use supplementation
Mm-hmm.
to give the body some more energy and information to get the healing process moving,
Mhm.
and that can really help. And then we deal with exercise, lifestyle
Mm-hmm.
factors, which are also extremely important. So
Right.
diet, supplementation, lifestyle. I just had a patient recently, he was able to finally recover from in sort of a long time autoimmune issue by learning how to calm his mind.
Yeah.
That was really amazing to me.
I had another patient just recently who he was diagnosed with an autoimmune disease, and I looked and he had an imbalance in his immune system and his blood sugar system. His doctor never ran a fasting insulin. We did. I found, even though he was actually seeing a nutritionist for weight loss, they gave him the wrong diet for what was wrong with him. And now, a couple of weeks later, the chronic pain that he had is completely gone. Yeah, so that's what happens. If you make a correct assessment and then you have the correct treatment tools, then a person gets better very quickly usually. Unless it's been, like I have one patient right now who's taking a little bit longer because she's 70-something years old and she hasn't felt good in like 40 years.
Yeah, sometimes you have to rebuild a person's capacity for healing before they will even begin to feel better.
And we have we have the test for assessing where a person is. We've got the foundational nutritional exam, then we've got the nutrition response testing and the comprehensive blood and urine analysis.
Yes.
So,
Yeah. Okay.
What else do you usually go over when you do your consults with patients? Is that basically?
Oh, that was way more than what I usually talk about.
Ooh, that's
Yes.
pretty good.
So
Bonus.
you just got the free consult, pretty much. But I am definitely available if you want to call up for a free consult, if you have any additional questions for me, or if you'd like to hear me go over this with you.
Yeah, because usually what
I'd be
you
happy
do.
to do that.
Yeah, usually what happens is when you call a person, is they you go over what their symptoms are, what they've done so far, how that's worked, and what their questions are, right?
Mm-hmm.
Yeah.
And then I talk about the assessments and that's how we do it.
Cool.
All of our recommendations are completely natural and safe. So we never use something that could possibly hurt you. So we would never use a surgery, or many medications also have bad side effects. Nutritional supplements do not have side effects,
They do not have
especially
side
the whole
effects.
food ones that we like to use.
No.
So that's the advantage of our therapeutic approach.
Yeah, the thing is too, is if someone actually, and we're not shy about referring somebody out, so we use interventions that did not have drugs or surgery. It's more like diet, lifestyle modification, supplementation. But if someone actually does need a medical referral, we are not shy
No,
about
not at all.
referring a person out.
We know what we can handle and what we can't.
Yeah, we're not anti-medical. It's just that with a lot of things can be handled. With a lot of problems, they can be handled naturally.
And they should be handled naturally,
Yeah.
because they will not be handled any other way.
No.
Right?
No.
Right? Am I
That's right.
Okay.
That'd be right.
All right. Well, thank you for joining us. And if
Do you have any other
questions,
questions, John? No. All right.
all right, signing
Well,
off.
take it easy.